This one is for all the moms out there who are getting adjusted during pregnancy but have no idea why they should be getting adjusted postpartum. Well, I'll give you a quick sneak peek. For starters, you basically just ran a marathon. Do you think marathon runners train really hard, run the race, and then quit from there? No way. They have a massive and detailed recovery plan, and you should too. You spent months preparing and training for baby's birth, creating the perfect registry, reading all the books, and maybe even creating a birth plan or goals. But right when your beautiful baby has arrived, you might be feeling surprisingly overwhelmed, physically depleted, and wondering why no one warned you about how challenging the postpartum period would actually be. Now, while most resources focus on labor and delivery, the reality is that the fourth trimester lasts far longer and receives just a fraction of the attention and support that moms deserve. So let's talk about what really happens to your nervous system during birth. Birth is truly a marathon, both physically and neurologically, for mother and baby alike. For moms, labor and delivery demand extraordinary physical exertion, with your body producing complex hormones while experiencing intense pressure, stretching, and sometimes tearing of tissues. These physical and emotional stressors create what we call subluxation, areas where the communication between your brain and body become compromised. Now, for mothers, subluxation commonly occurs in the pelvis, lumbar spine, upper cervical spine, and thoracic areas, affecting everything from core recovery to hormonal regulation. Not to mention, within 24 hours of birth, your estrogen and progesterone levels, hormones that were elevated during pregnancy, plummet dramatically. And this abrupt hormonal shift is often described as falling off a cliff hormonally, and it profoundly impacts your nervous system. That's because these hormones don't just affect reproductive functions. They directly influence neurotransmitters in your brain and the balance of your autonomic nervous system. So when your nervous system becomes dysregulated during this hormonal flux, it can lead to difficulty sleeping, anxiety, temperature regulation issues, digestive disruptions, and heightened sensitivity. So how does neurologically focused chiropractic care support you in your postpartum journey? Our approach begins with comprehensive insight scans that provide objective measurements of your autonomic nervous system function. These scans serve as a window into your nervous system, allowing us to pinpoint exactly where and how subluxation is affecting your neurological function. Then gentle, specific adjustments help restore proper pelvic function, reduce neurotension in your upper cervical spine, and enhance nervous system communication for hormonal balance, improving sleep quality, and supporting proper muscle engagement. And for baby, gentle pediatric adjustments use pressure comparable to testing the ripeness of an avocado, light and precise, to release birth-related tension and support optimal development. So are you needing some fourth trimester support in that recovery plan of yours? Make sure to schedule a postpartum adjustment. And if you aren't a patient yet, that's okay. Let's get some neurological insight scans done and see how your nervous system and your growing baby's nervous system are functioning. Then we can give you an amazing postpartum game plan. Just visit our bio to learn more.